Hello everyone, myself Dr. Rajesh Khanna, Consultant Pediatrician at KIMS Cuddles, Kondapur branch. Abdominal pain in children is a major complaint and a frequent cause for the outpatient visit at Pediatrician. What happens to the child is unknown to the parents, whether it is major or minor when they complain about abdominal pain, because the pain they present with will be very severe that parents definitely get panicked, and all these abdominal pain causes we are worried about the surgical causes, especially the acute appendicitis. So what happens in surgical causes is, if we delay the treatments, there will be major complications. So to rule out the major cause, that is surgical cause for the pain, we need to examine the child compulsory, and 90% we find out that it is not due to any surgical cause, it's not due to any underlying major issue. It's most of the time it's a functional gastrointestinal disorders, that is the structure remains normal but there is deranged function of the gut. Gut needs good bacteria, that is ubiome has to be preserved. Due to excess junk foods or less fiber intake, less water intake, gut microbiota is disturbed, leading to dysbiosis of the gut, thereby excess bloating of the intestines due to excess gas production, and the tummy pain is the end result. This is called functional gastrointestinal disorder. This is functional abdominal pain. For this, what we have to do is, one, pediatrician has to examine and rule out the surgical causes. If required, if associated with fever and vomitings, ultrasound abdomen is required. If fever and vomitings are not there and there is no tenderness, what we advise is increase in the fiber, that is fruits and vegetables intake has to be increased and water intake has to be increased, and they may require some antacids to reduce the reflux, GERD, gastroesophageal reflux disease, or that is due to gastritis, excess acidity production, and change in the diet pattern. And if the child is very apprehensive, we may give antispasmodics. Probiotics, the latest probiotics for especially FGITs, lot of studies are there, so usage of probiotics are also recommended. School absenteeism is the major underlying factor what we see sometimes without any other issues as well, but all these children will get definitely benefited if constipation is ruled out and laxatives are used. Simple diet modification helps in majority of the cases.